how important has social media been for you in your work?
Oh, I don't think without social media, the technology would have exploded the way it has in the UK. Full stop. I mean, there's absolutely no debate about it. Authenticity is a very important thing. People need to know that what they are seeing is what it is. So, one thing I always make pains to do, and you met me in person, is that I am who I am. That's who I am, right? The way I come across on social media is the way I am. I'm passionate, I'm exuberant, I'll be trying to be humorous and all that sort of stuff. But I've also bring in face-to-face setting with a lot of people the Marmite fact. They don't like my style, they don't like my drive. You'll have people who grudgingly like me, people who don't like me. But that's the package. So what you see online is no different from that respect. We are probably one of the first, if not the first country to roll it out at this level of scale in a public health system. So I think that's what's been exciting for a lot of people. I'm a big believer in data, right? I think if you're going to do change implementation and change management, you need to understand and reflect data, and you need to reflect it with a degree of boldness. I think if the data shows something is not right, I think hiding away from it is probably the wrong step.
My conversation with Partha Kar was a journey into how to use social media to drive access to better healthcare. And Professor Kar talks about how important social media has been for that. In fact, he says that without social media, there simply would not have been what he calls the explosion in access to better technology for people living with type 1 diabetes in the UK. So we talk about some really practical ways in which social media has been used to shape policy, drive better access, and ultimately improve patient care. And you don't want to miss his advice for any healthcare professional who wants to build their network and achieve a great outcome on social media. Here we go. Great. Well, I'm here with Dr. Partha Kar. Partha, great to have you here. Thanks for joining us.
Thank you for the invite.
And maybe I can kick off with this. Could you tell us about what's your current location? What's the view from your chair?
Well, view from the chair is not very pretty at the present moment. It's spitting with rain. Not quite spring, but I suppose it's all throughout the UK at the present moment. So yeah.
Lovely British weather.
Indeed.
Maybe you could tell us a little bit background to you. Tell us what you do, how long have you done it, and how did you get into it?
Yeah, so I mean, many roles, many hats. The one relevant for now is I'm the type 1 diabetes technology lead and for NHS England on that sort of aspect. I'm also a consultant in diabetes and endocrinology in Portsmouth. I've done that for about 15, 16 years now. So I've been doing the national role for about 8 years. Apart from that, I've got other roles with the General Medical Council, the Royal College of Physicians, do a lot of other stuff. But our main focus has been in getting greater access to technology to people living with type 1 diabetes. That has been sort of a big focus going forward. So that's been the role. And it's been a long time going on. So that's probably a short gist of the journey.
And how did you get into that? What sort of attracted you to the area of diabetes?
I think I always say that the two reasons for it. I mean, one is the people I interacted with much younger in my career. So I had consultants like Tony Zalin, I had consultants like David Jenkins, who were very sort of inspirational in their own way. And I think what I also liked, the fact that it was like they were part of a person's journey through their life. It wasn't just one particular episode. It was they were trying to sort of be there for them through the whole chronic disease pathway. So that attracted me in its own right. And I think that's brought me into the specialty, and the rest is history, as to say.
Wow. So you actually inspired by how you saw other consultants working and what you saw in their work.
Yeah, 100%. 100%.
And today, what's exciting? What's kind of most exciting you about advances in the treatment of diabetes?
So I think if you look across the board, and I would say in type 1 diabetes, it's got to be sort of the hybrid closed loop, which has come through, which is, taking a lot of the day-to-day working out of the person's hands, and they're doing a lot of it automated. That's in type 1 diabetes. I think in type 2 diabetes, there are some interesting medications which have come through now, which has got real good potential about prevention. So those are probably I would say the two areas. But in the world where I inhabit mostly in the policy space, type 1, is definitely technology, and technology which is driving the whole focus of self-management. That's what I would say.
We saw just this week some, significant amount of news coverage in the UK about what's been headlined as the artificial pancreas
Mm.
being available to type 1 diabetes patients, certainly across England. And really, I was interested to see how the media really picked up on that. Tell us a bit about that. And I mean, that's a major milestone, right?
Well, it is. I mean, I think I always say, type 1 diabetes has three parts. You prick your finger, the number comes up, you think about what to do with the number, mental maths, and then you give yourself insulin or glucose as may be needed. And now here we have a technology that automates a lot of that. We already had continuous glucose monitors, which was basically you don't have to prick your fingers; it just comes on your phone. And I think doing the next step of delivery of insulin is quite exciting. It's still not quite the final product, if that makes sense. And artificial pancreas can be sometimes be a misnomer because it conjures up images that it was just going to be done for you. Not quite. You still have to do a fair bit of work on it. But it's a quantum leap from the days of, you have to draw up your insulin and do some thinking as to how much it is and look at the food and make a guess and then inject you insulin. So lots of progress forward, still not the finished article, but no, and I think that's why it's caught the attention, but mostly because we are probably one of the first, if not the first country to roll it out at this level of scale in a public health
Mhm.
system. So I think that's what's been exciting for a lot of people.
Amazing. So, what do you think now are the biggest challenges facing, let's say, type 1 diabetes therapy area? Locally, nationally, globally.
Well, if I start locally and then go out to globally, I think
Yeah,
locally it would
great.
be about access to these sort of technology on a more uniform basis. I think with continuous
Mm.
glucose monitors, it took us a good 3-4 years to get cut across the variation of postcodes and deprivation and ethnicity. So I suspect there'll be a very similar challenge with this particular technology as well, because there's a training need involved and everything like that. So that probably will be the biggest challenge to make sure that it's done evenly. And I don't expect it to happen probably in the first year or two. I think year 3, year 4,
Mhm.
you'll start to see that all sort of evening out as things progress. Then if you go outside locally, I think globally the bigger problem is access. Simply, you've been talking about basic stuff like insulin and at a cost price that is available to everybody. So I'm doing a work nowadays with JDRF based in focused on India, which is very much about access, insulin, glucose strips, and all that sort of stuff. So it's a very different cry away from what we're talking about, technology. But different countries with their different economies and different sort of views of healthcare have got different challenges, and that's where we are at.
But it sounds like from what you're saying, both the local challenges and the sort of global level, different international challenges, access to whatever the kind of current cutting edge treatment or approach is available in that nation is still probably the challenge. And you talked about in locally in the UK that it may take some time for everybody really to get access to what's
Yeah,
available.
yeah.
What do you think needs to happen? How do we address that? Because that's it's a health equity issue, isn't it?
Oh, 100%. And I think it's the same strategy which we've adopted with glucose monitors, continuous glucose monitors, and then how we tackled it in pregnancy. I'm a big believer in data, right? I think if you're going to do change implementation and change management, you need to understand and reflect data, and you need to reflect it with a degree of boldness. I think if the data shows something is
Mhm.
not right, I think hiding away from it is probably the wrong step, right? Trying to couch it in nice words and say, if it's not right, it's not right. And I think after that comes the issue, don't just put the data. I think a strategy of, here is some data, can you please do better, is not a strategy. That's just, you're
Uh-huh.
hoping on other people's goodwill to do the work for you. And if they don't have the same ethos as you, or don't see the problem that you are seeing, that's not going to work. It will work for some people, but not for all. So I think that's where you need the data, you need the accountability, you need regular sort of reviews as to where you're progressing with the data, divided into deprivation quartiles, etc. Give targets for people to reach, and where you need to sort of invest accordingly to say, right, okay, if this is the problem, then let's try and see what we're going to do to close the gap. So I think that needs a very clear strategy going forwards where you go with it, but it's very doable. I would say it just needs a bit more bravery around it.
So that's really interesting that you're talking about data, and what I'm really hearing is it's about communication, right?
Mm.
Achieving a good health outcome is
Oh,
ultimately about good health communication.
100%.
And you know, for your role as not only a physician treating patients, but actually a policy shaper, a policy leader
Mm.
for the UK. That communication has played a really important part, as I see in your work. How do you see that?
100%. I mean, a leadership to me is about two or three things. I think, first of all, leadership needs to be about accountability. I think a lot of leadership has become, here are some documents, here are some papers, here are some policy, I've done my bit. I don't think that's leadership. Leadership is about implementing those documents and policies. And and I don't think it's always about successfully implemented, because I think people respond to you if you have tried. I think if you tried and then you failed, that's fine, because leadership is also about failure. And you need to own that failure. Go, look, guys, I tried my best, didn't work. I think the problem happens when you don't have either of those and you just produce a document and say that's done. And I think the second thing, which I really believe in leadership, is the ability to come out and be honest with your communication. And I think the majority of people respect that. If you come out and say, look, I can do this, but I can't do this, and this is the obstacles, I think people respect that far more. So my style has always been to communicate where we are. What are we doing? Why is it going at it? So, for example, we were talking about hybrid closed loops. It's not available to everybody with type 1 diabetes according to the guidelines yet, but I made it very clear, guys, this is where we are at. But I promise you, in 2 years' time, we'll try and make it to everybody. But that's the process, and people understand that. I haven't had any negativity about that throughout my career from people living with type 1. So I think my leadership style has always been about communicate openly, and communicate using different channels. Don't be shy of social media. Don't be shy of blogs and podcasts and all of that. Come out and speak. And I think it's important.
Great.
Right? So, yeah.
Hi, I'm interrupting briefly to ask for your help. If you're enjoying the show, please find the show on your player, Better Listening for Better Health, and hit follow. It will really help us as we book in great speakers for our next series. Thank you so much. Great. Well, let me ask you about social media. We at Creation, we ranked you among the world's most influential, healthcare professionals in the diabetes space on social media. How important has social media been for you in your work?
I don't think without social media, the technology would have exploded the way it has in the UK. Full stop. I mean, there's absolutely no debate about it. There is absolutely no way we would have tackled all the postcode lottery. It just would not have happened. I can tell you that because there are many, many leader colleagues in other spaces who don't use social media, try and use different channels, the official formal channels, and, coaxing. It doesn't work. And that's why they have all the gaps. We don't have any gaps in continuous glucose monitor uptake, because we have been very open and very, very clear about using lots of different channels. So I think without social media, I don't think the success of the type 1 diabetes world, we have gone from being one of the laggards in technology access globally, or at least amongst all the European countries and all the sort of, countries with good economies, to pretty much one of the leaders. And I think we would undersell social media if we said that it didn't have a major significant part to play in here.
So what does that look like for you practically? Talk us through your approach to using social media to actually bring about that change.
So I think social media to me is, I use it for two or three things, apart from the sort of usual sort of some frivolity of a picture of my dogs and what I had and all that sort of stuff. On a policy role, I would do two or three things. One is there will be something which is factual, so which is raising awareness, right? So, for example, type 1 diabetes can't be cured by diet and all that sort of stuff. So it's factual, reinforcing sort of messages to raise the profile of type 1 diabetes. The second one probably would be a bit of science, to say, here are some, trials come out, here are some things. Hey, listen, immunotherapy is coming. Look at the trials, and it's very important. So you're sowing the seeds for people to think about it. And thirdly, and more importantly, it's wrapped up with the policy space. I would come out and bat for somebody or some people with type 1 diabetes. So if they've had a problem, I would sort of go like, right, what's the problem? And I would correct people directly, clinicians or systems. Sorry, that's not the rule. And I think that is a very, very strong plus of using social media, because the people with type 1 diabetes know that come hell or high water, I will not duck behind a corporate emblem and say, I'm not helping you. So if they say, I can't get access to this, I'll say, all right, what's the name of your team? Tell me, or drop me an email. And I will then pick it up and talk to them. So those approaches, I think that personal approach does help. People shy away from it, I know, but I have found it to be incredibly productive. So I think I use social media. So raising awareness, a bit more science, a bit of what's coming, a bit of sort of batting for the people with type 1 diabetes, all of them have a bearing as you go forwards.
And are there particular social media channels that are sort of more important to your work, that you're more effective for you in your work, do you think?
So everything has got a slightly different nuance. I think
Mm.
Twitter or X, Facebook, LinkedIn, and Insta, those are the four that I use, and they've all got
Hmm.
slightly different audiences, and I think that's quite important, right? So
Yeah.
LinkedIn would be, for example, very much be about my professional connections. It's about what we have done professionally, policy, what's rolled out, what's coming. There's that. X or Twitter is more instantaneous. It's more
Mm.
emotional, if that makes sense. So you need to have that sort of wrap
Mm.
around it. Just having papers doesn't attract the people. It's more angsty, if that makes sense. It needs to be more
Uh,
pathos in it. What are you talking about? That sort of stuff. Facebook is very much an
Provocative? Would you say
Oh,
provocative?
100% provocative. Absolutely. The whole
Yeah.
thing. That's what
Yeah.
Twitter and X is. And to be honest, that's what
Mm.
Elon Musk has created. We can criticize him for it, but that's
Mm.
that's the platform he's created. Its own niche of that whole provocation and all that, right? That sort of whole
Mm.
field.
Mm. Mm.
Facebook is again very different. They are very much about me reaching out to people with diabetes,
Mm.
type 1 diabetes, directly, information cascade to them. So while LinkedIn is an information cascade to policymakers, Facebook becomes an information cascade to people living with type 1 and their parents and their carers, right?
Uh,
And then finally, Insta is very quick fire in the sense of it's less provocative because it's very much about pictorial, very much about visualization. So there's a bit of reels, a bit of
mm.
videos, a bit of here's what's coming, and a picture of somebody with type 1 who's lived with it for 52 years and has got a medal, that sort of stuff. So I think it's got very different audiences, and I think you need to slightly amend your outputs accordingly, I would say.
Right. Yeah, yeah, amazing. So, what advice would you give if there's a doctor, a physician who is looking to kind of say, well, I'd like to make an impact online. I'd like to grow my knowledge and impact online. What advice would you give them?
I think the first thing I would do is I wouldn't do anything but observe a few big guns. And when I say, and
Hmm.
you shouldn't observe just the people you like. I think that's important, right? You should also observe
Mm.
people who you go, oh, I don't like their postings and stuff. But then you need to think about why is it that they have this sort of level of engagement? What is it that they're doing? Is there anything I can learn in the sense of that's something I will not do, but that's something I really
Mm.
like. Okay. And I think that's important. So I always say go and pick 10 people, five you really like, five you don't, and just follow them for a bit and just see what they're doing. And then after that, you need to start building, you need to, for example, and then think about what is it that you're trying to sort of push? What is your specialty area? How confident are you about your own area? Because you don't want to come across and say something and get absolutely ripped apart in day two. So, and
Yeah.
then I think that's how you build your audience with a bit of respect, with a bit of sort of understanding
Mm.
going through. And I think you build your kudos, and then you can reach out and start sort of doing a little bit more provocative stuff, pushing the boundaries a little bit of saying, well, I don't agree with, for example, this medication being, and then you have lots of people, why would you say that?
Mm.
All the rest of it. So I think you have that sort of mixture of things as you go along. But my advice always is try and observe people first, learn from their styles, what you would do, what you wouldn't
Brilliant.
do, and then decide on that.
Mm. Brilliant, brilliant. So, what would you do differently if you were sort of starting over, getting online now
Mm,
for the first time? If you can imagine that.
mm.
What would you do differently?
Um, I think I don't think I would do anything much differently because I think I felt my way very much as I've gone
Mm.
along, right?
Mm.
And I've always said this, and I think people use social media policy guidelines as some sort of beating stick in the sense, oh, if you do this, then you'll get in trouble. That's not
Mm.
true. And I
Mm.
think people
Mm.
misunderstand. I mean, there are legal rules around your freedom of expression, right? I always say, if you're going to use social media and you're not doing something, A, don't tweet or do stuff when you're drunk. And secondly, I think if you're going to
Mhm.
bring out on a public forum your sexism, racism, homophobia, or any of that sort of protected characteristic, quite rightly, you should be
Mm.
punished for
Mm.
that, right?
Mm.
But otherwise, it's a free society where you can have an opinion. Because I've had this discussion with many
Mm.
people who've gone like, well, I don't agree with you, and I said that's okay. It's a democracy. You're supposed to disagree with
Yeah.
me.
Yeah.
As long as we're doing it respectfully, I have no problem. So people, and I think some people take it to other edges. And they go like, "Oh, I don't like you because of what you say," and I said that, but that's okay as well. It's fine. Nobody can be universally liked, and if you're going to make your judgment about me based on some tweets I made rather than meeting me in person, that's your choice, not mine. But I don't have anything to say to that. So I think it's about people understanding what you can and cannot do, right? So, and finally, I would say people have asked me that, oh, can you speak against an organization you work for? I do it regularly, as long as it's done with respect. There is a term which is called grit in the
Yeah.
oyster, right? I have been a national role for 8 years, and I'm as provocative as you come. I speak against my own organizations all the time. But as long as you're not doing things which are silly, if I come out and said my chief exec is X and Y and doesn't, of course you can be disciplined for that. But I think if you say I don't agree with the policy they've decided on, it's a democracy. It's not you can't. So I think people need to understand the
So,
rules better.
So do you think there's something in that of feeling free to be outspoken and express your view with respect is actually do you think that there's something there that actually brings authenticity and
Oh,
integrity
100%.
to who you are
100%.
online?
Authenticity is a very important thing. People need to know that what they are seeing is what it is. So one thing I always make pains to do, and you met me in person, is that I am who I am. That's who I am, right? The way I come
Yeah.
across on social media is the way I am. I'm passionate. I'm exuberant. I'll be try and be humorous and all that sort of stuff. But I've also bring in face-to-face setting with a lot of people the Marmite factor. They don't like my style. They don't like my drive. You'll have people who grudgingly like me, people who don't like me. But that's the package. So what you see online is no different from that respect, is what I always say. And I think that is very important to be authentic.
Absolutely. There should be no surprise when someone meets you in face to face and realize they don't see something different, right?
Yeah, they go like, "Oh my God, he's a shrinking violet. What's going on?"
No, absolutely. Okay, great. Thank you so much, Dr. Kar, for sharing your experience, for all you're doing online. I've certainly learned a lot from you as I've kind of observed you and what you're doing in the diabetes space. Where can people find you if they want to find you online, follow you?
I always say just on Twitter, I'm there, Partha Kar. I'm on Facebook, I'm on LinkedIn, I'm on Instagram as NHS Sugar Doc. I write blogs. I do podcasts like this, so I'm pretty freely available, and my emails out there in the public domain. I'm always happy sort of communicate with people and give tips and advice. No problem.
Brilliant. Well, thanks again so much for sharing your experience.
Pleasure. Thank you.